I'm trained in naturopathic medicine and acupuncture, so I'm going to be using that scope and perspective going through everything today. And with that being said, though, there isn't much in the research specifically on integrative medicine in ECD, so we're going to be just talking about the foundations and core approach and perspective that we come at each patient with in integrative medicine. So I'm not sure if this has already been done already, but I do want to acknowledge that the land that we're on today is of the Coast Salish peoples and tribes, and that includes the Duwamish, Suquamish, Puyallup, Tulalip, and Muckleshoot First Nations peoples. So if you, as you walk around today, just consider how you might be able to be a good steward of this land. I don't have any disclosures regarding what we're talking about today, but I do want to have you be able to walk away with a bit of a better understanding of what integrative oncology means, some of the treatment modalities that we're going to be using and referencing. I'm going to provide a few resources, not only on what we would use as clinicians, but also what is free for you to use as patients and caregivers. And then also think about how we can apply some of these principles within the context of ECD. So the Society for Integrative Oncology, or SIO, defines integrative oncology as a patient-centered, evidence-informed field of cancer care that uses mind and body practices, like Kevin was talking about, natural products and lifestyle modifications that are delivered alongside conventional cancer treatments to optimize health and quality of life and improve clinical outcomes or specific symptoms. And really what we're working on is empowering you actually to become a much more active participant before, during, and then after your active cancer treatment. So integrative medicine is high in use among patients with cancer, and it continues to rise. According to the more recent report from the National Center for Complementary and Integrative Health, especially in the use of meditation, in yoga, and massage therapy. Integrative therapies are there to improve quality of life and even survival outcomes, to augment and go alongside conventional cancer treatments to potentially manage or prevent some of the side effects, and then also address any of the pre-existing conditions and, as we were just talking about, pain. And we really are talking about patient empowerment with complementary and integrative health. While much of this, though, may be self-driven, especially when we talk about things like using a natural product, it's very important that you are consulting and working alongside with your physician, being upfront about whether you are having pain or are having fatigue, so that they can guide you to using an appropriate therapy that is known to work, and they can counsel you on whether or not there may be something that could actually be harmful to you. At Fred Hutch, integrative medicine is in the division of supportive care, and we offer lifestyle counseling, mind and body therapies like acupuncture and meditation, and we consult on the safe use of dietary supplements. And those are the kinds of discussions that when you go in to see an integrative medicine practitioner, what you'll be talking about. Now, the recommendations may vary from provider to provider, but they're going to be based on the therapeutic evidence that is available, as well as your values and what you're seeking from treatment and their own expertise. These are some of the main resources that our team refers to, and many of these are freely available on a wide variety of topics, including about herbs, sources from the NCI and NIH, as well as the Society for Integrative Oncology. NatMed down below is another great source for dietary supplement interactions, though it does require some licenses. So integrative medicine focuses on the whole person, focusing on supporting whole health. Each of you are going to have a complex and unique set of symptoms, as well as just life situation. And so we need a similarly comprehensive and catered set of tools to address any of our concerns. The World Cancer Research Fund and American Institute for Cancer Research developed a great example of one of these comprehensive wellness guidelines that focuses on healthy lifestyle practices to prevent cancer. And that includes things like being a healthy weight, being physically active, eating a whole foods plant-based diet that's low in sugary and sweetened beverages and alcohol, avoiding the use of dietary supplements for specific things like cancer prevention, and limiting sun exposure and tobacco use. But what this is missing is that why and that how. So what can work for you and what tools do you need in order to meet these recommendations? We talked a little bit about a cycle already, which I very much so appreciate. We also talked earlier about the hallmark of one of the hallmarks of ECD and cancer is inflammation. And it's a pattern that we commonly see that is a core portion of some of the complex symptoms that we have. So inflammation can be a bit like a teeter-totter. Inflammation in and of itself is not necessarily a bad thing. It can stimulate your immune system to have an adequate response to a stimulus, but long-term it can actually be harmful. And it again creates an imbalance on that teeter-totter. Stress is both a sign and cause of inflammation. And so both pro-inflammatory and anti-inflammatory mechanisms depend on those types of stressors. So those acute short-term stressors, that pain in your leg that we were just talking about, can cause swelling in a certain area where there's injury. But long-term stressors like having something that you're carrying with you every day that's going to be a little bit less visible can also lead to an imbalance in your immune system and inflammatory processes. That can lead to poor sleep, and sleep plays a role in regulating your immune system, and also, as we were saying, is associated with that higher inflammatory processes, but good sleep helps us process stress. Poor sleep then, of course, leads to fatigue. Fatigue prevents us from getting things done that we need to do throughout the day, leading to more stress, perpetuating this cycle, and can also, again, as we've already said, reduce physical activity, which can lead to pain due to lack of movement. And so what we know, each of these also contribute backward and across the cycle in order to in order to create a complex picture like we're seeing. And this is where an integrative medicine provider can come in handy to set you up for success with finding the right path to take, which symptom to target first, and how you can target multiple at a single time. Now, one of the ways that, in my opinion, that's really foundational and has an impact on all of these is your diet. So inflammation is a part of the immune system, but 70 to 80% of your immune system cells are actually found in your gut. Healthy immune system can be supported through a healthy diet, and that's by supporting the microbes and bacteria that are in our gut called the gut microbiome. The gut microbiome is quite diverse. My microbiome is going to be very different than yours. Yours is going to be very different than the person who's sitting next to you. But those bugs that are in your gut microbiome play a very, very important role in digesting food and actually synthesizing some of the vital nutrients that we need, like B vitamins and vitamin K. There we go. So we also know, though, that cancer treatments actually have a negative impact on the diversity of the gut microbiome. Low diversity has also been implicated in the development of treatment side effects that are associated with cancer treatments. And then it has also been implicated in actually having a role in predicting response to treatments like bone marrow transplants. All of that really to say is that we need to be investing in the diversity of our gut microbiome. And by creating the correct environment, we are supporting our ability to be as well as we possibly can. And the basic recommendation is to give the gut microbiome what it wants, and that's going to be whole foods. And really fiber is what's key here. And fiber is found in all plant foods. What you hear is eat a plant-focused or plant-based whole foods diet, and that's going to be rich in fruits and vegetables, whole grains, and legumes like beans. And much like the image, we're really wanting you to try and aim for the rainbow when we think about our plants. Begin with at least 2.5 cups, but really you're actually aiming for 5 or more cups of fruits and vegetables per day as your end goal. And whole foods, by eating more whole foods, you're actually reducing your ability to intake some of those processed foods. including sugary and sweetened beverages or fast foods that have a negative impact on your gut microbiome. It helps us maintain a healthy weight, immune function, and reduce inflammation. Now, those recommendations may seem pretty second nature to you, or you may not even know where to begin. So regardless of where you are, a really wonderful and free to use resource for all things diet related in cancer for prevention, during active treatment, and in survivorship is Cook for Your Life. It was founded as a nonprofit, it was founded in 2007 by a 3-time cancer survivor, and has over 1,000 recipes and instructional videos, both on recipes themselves and cooking techniques in order to help you meet your dietary goals. And they have seasonal nutrition tips, some research updates, and we are also tabling just outside. So if you do have any questions, come reach out to me afterward and we can talk about, my favorite thing, which is good food. But something that I think we've already said, not necessarily at the top of everyone's favorite list, is physical activity. Exercise can be really, really uncomfortable, but physical activity does go hand in hand with maintaining a healthy weight, processing stress, improving fatigue, and getting good sleep. Regarding weight is just to measure the process to get to a healthy weight. That action is being physically active. And so what we can do is lean a little bit on some of the things that I think every one of you are carrying around, which is probably your phone or a smart device that can track your physical activity, helping you stay motivated in order to reach the goal that's been pretty well established at 150 or more minutes each week of moderate to vigorous physical activity. And that's measured as you can still carry on a bit of a conversation while you're exercising, though it might be a little bit limited. But as we've already said, that's going to be different for every one of us. My physical activity that I prefer is going to be running, but it might be that you need to cycle, that you're doing chair yoga, or that you're swimming. But starting with 30 minutes of any active movement each day, going throughout the week at that process, and really making incremental steps toward that goal is going to keep you enthusiastic and, most importantly, uninjured during that process. A similar favorite pastime other than diet with me is sleep, and we talked about this as well. So guidance on sleep hygiene, so the practice of setting up that optimal environment for sleep. From the Fred Hutch Clinic, you can actually, there's a QR code down at the bottom right for a patient handout in case you'd like to review that. But especially if you're not from a city here in Seattle, it can be really challenging to create a space that is dark, that is quiet, that is cool. And it can take just time to find out how you can make that environment. A number of factors can negatively impact your sleep quality. That will be caffeine later on in the day. We already talked about physical activity, but a degree of heavy physical activity in the evening can also negatively impact your sleep. So making sure that you are setting up your environment, reducing blue light, slowing down as the day goes on so that you can get good sleep is really the way to go. Mindbody Medicine, this has also been talked about by Kevin, which is great. And there are also, again, some really great tools down at the bottom right for how you can get parasympathetic. And that is really that rest and digest period. Mind-body techniques have been studied on their own to improve pain, improve fatigue, but have also been shown that when given in addition to some of those medications, again, like Kevin was talking about, it actually improves their efficacy and can actually be a really great way to augment those therapies. Once again, much like physical activity, the way that I practice mind-body medicine is not going to be the way that you do. Seated meditation that's going to be quiet is never going to work for me. And so a movement-based technique is what I'm going to seek out. But exploring what those look like to you is going to make you, to help you actually be inspired to begin a practice like this. Another specific therapy though, because sometimes diet actively getting your, good sleep and physical activity, you do need just a little bit of a nudge to treat a very specific symptom. So knee pain, if that's preventing you from getting physical activity, what can help with that? And one option is acupuncture. Acupuncture uses fine needles on very specific points of the body and has been one of the most well-studied complementary techniques in cancer care for addressing things like neuropathy and pain, sleep, insomnia, and fatigue. But we also use massage techniques, herbs, things like cupping, but making sure that you find a integrative acupuncturist who has experience with oncology is very much recommended, so that there can be complications that come from these. So just making sure that you're finding an acupuncturist who is literate in the field. Oh, there we go. So if you do go into an acupuncturist, and this is about what we do at Fred Hutch, you can expect about a weekly treatment that would go on every week for 8 weeks or so, at least to begin. They'll usually last about an hour. You may get some immediate relief from your symptoms, but chronic symptoms may also take longer, like fatigue may take a little bit more time to address. We also, within dietary supplements, this is a massive area of interest, but what we typically say is that dietary supplements are exactly as their names say, supplementary to your diet. And so if you can create a whole foods plant-based diet that is rich in the nutrients that are necessary to support your gut microbiome and to support health and wellness, in general, the dietary supplement will not be necessary, but making sure that you're consulting with your provider before initiating any of these supplements or changing their dose, so that they are done in a manner that's safe, indicated, and necessary. So I'm going to leave you with some of these key takeaways. Hopefully you'll get access to these slides afterward. Being of a healthy weight through physical activity and eating a healthy diet, avoiding alcohol and tobacco, getting good sleep, and using mind-body techniques to improve resiliency, finding some of those specific therapies that may help you address some of the hindrances for you to meet these lifestyle recommendations, and use of dietary supplements as safe and necessary. I am funded by the National Center for Complementary and Integrative Health, but I wanted to thank the incredible team at Fred Hutch that continues to grow. We've been there now for 7 years and has expanded quite dramatically. Dr. Greenlee also is currently leading the Cook for Your Life program. So I really recommend come out and chat with me so that we can talk about some good food.